My videos don't necessarily promote one religion. My views and opinions aren't meant to change the minds, opinions, or beliefs of others. Watch with an open mind. Copyright disclaimer. Under Section 107 of the Copyright Act of 1976, allowances made for fair use for purposes such as criticism, comment, news reporting, teaching, scholarship, education, entertainment, and research. Fair use is a use permitted by copyright statute that might otherwise be infringing. All rights and credit go directly to its rightful owners. No copyright infringement is intended. We continue to uncover the profound wisdom within the timeless scriptures. Take care, and God bless.
The human brain is a remarkably resilient organ, but even brief interruptions in oxygen and blood flow around the time of birth can cause significant injury. That's why brain cooling or therapeutic hypothermia has become an essential treatment for newborns with hypoxic-ischemic encephalopathy, or HI. This therapy can greatly lower the risk of brain injury and enhance long-term outcomes for babies facing the challenges of life outside the womb. But what exactly is therapeutic hypothermia, and how does it help protect these fragile newborns? In this episode of Grand Rounds, we'll explore the latest research and clinical advancements in the field of neonatal brain cooling. I'm your host. Today we're talking about brain cooling and specifically total body cooling. So let's start by answering the question, which infants are candidates for total body cooling? When a labor emergency arises, the delivery team promptly informs the NICU. They gather all relevant details about the situation and request the NICU's presence at the delivery. Once the baby is stabilized and transferred to the NICU, the neonatologist performs an initial assessment to identify any signs of possible brain injury or HI. Elevated levels of acid in the baby's blood is a typical response to low oxygen. This suggests a problem with the circulatory system, such as a heart defect or a severely low APGAR score. A low APGAR score lasting more than 10 minutes is a sign that the infant is not transitioning well to life outside the womb. This can indicate a range of issues, from respiratory distress to problems with the circulatory system or insufficient oxygen and nutrients reaching vital organs like the brain. Abnormal results on a blood test looking for kidney, heart, or liver damage also may suggest HI. Likewise, abnormal results on the neurological exam, for example, decreased spontaneous movement, irregular breathing or heart rate, inability to suck, poor muscle tone, also called floppy infant syndrome, or reduced alertness, may all signal possible brain injury. If multiple signs are present, there is concern that oxygen deprivation has caused brain damage. Moderate to severe HIE qualifies infants for total body cooling, also referred to as therapeutic hypothermia. Research is ongoing to determine if infants with mild HI might also benefit. How does the therapy work? Therapeutic hypothermia aims to begin cooling within 6 hours after birth, the sooner the better. To implement this treatment, the baby is placed on a special water circulating blanket that cools and later warms them. A small temperature probe is inserted into the baby's esophagus to monitor core temperature. The probe communicates with the blanket to maintain a stable environment. Infants have an impressive capacity to heal. However, in certain situations, reducing the body temperature helps protect the brain and prevent secondary injury. The target temperature, 33.5 degrees Celsius or 90.3 degrees Fahrenheit. And the duration of cooling is 72 hours. Studies have demonstrated that cooler temperatures or longer cooling durations do not provide additional benefits. Between 5 and 7 days after birth, an MRI is performed to identify any brain injuries. At the same time, the NICU doctors and neurologists review the imaging, birth details, and initial exam findings to estimate any potential physical or cognitive challenges the infant might face. Close follow-up is typically recommended as the baby grows. Although the brain is more resilient in infancy compared to adulthood, it's still susceptible to injury around the time of birth. Predicting long-term cognitive or physical outcomes after a traumatic birth is challenging due to the brain's remarkable ability to recover from injury. Now, let's discuss some of the labor emergencies that can necessitate cooling therapy. During pregnancy, patients are closely monitored for conditions that could restrict blood flow and cause brain injury. These rare events can complicate childbirth and potentially affect the baby's health. Placental abruption is when the placenta detaches from the uterine wall before delivery. This detachment cuts off the baby's supply of blood, nutrients, and oxygen. Usually occurring in the third trimester, placental abruption often presents with abdominal pain, back pain, and vaginal bleeding. In North America, it affects about 1% of pregnancies. Women with hypertension or who use drugs like cocaine, which cause blood vessel spasms, are at higher risk. Timely delivery and appropriate cooling therapy can help manage complications associated with placental abruption. Another emergency is uterine rupture, where the uterus tears during labor. This can happen during attempts at vaginal birth after cesarean, VBAC. If the uterus ruptures, the baby and/or placenta can move into the abdomen. Fetal heart rate and contractions are monitored closely to detect this emergency early. Symptoms include fetal distress and heavy bleeding. Uterine rupture is rare, affecting about 0.5% of deliveries. However, it's more common in women with prior uterine surgeries, increasing the risk to 0.7%. During labor, the umbilical cord can slip through the partially dilated cervix if the water breaks at onset. This is known as umbilical cord prolapse. If the cord is compressed between the baby and mother, blood and oxygen flow to the baby can be compromised. Women with a history of prior uterine surgeries, such as a myomectomy or C-section, are at higher risk of uterine rupture. In induced labor, the water is broken only when the baby's head is low enough in the pelvis to minimize the risk of cord prolapse. Spontaneous labor timing cannot be predicted, but this complication is rare, occurring in about 0.1% of births. Amniotic fluid embolism is an extremely rare occurrence. If amniotic fluid enters the mother's bloodstream, it can cause shock, respiratory failure, cardiovascular collapse, and severe bleeding. Early warning signs include fetal distress, maternal agitation, and skin discoloration. This condition occurs in about 1 in 40,000 deliveries in North America. Prompt treatment of the mother and assessment of the baby for cooling therapy are crucial in such emergencies. These labor emergencies are uncommon and patients are monitored carefully to detect any issues promptly. The quicker the mother is treated and the baby assessed for cooling therapy, the better the outcomes. Several factors influence the decision to implement brain cooling therapy. Clinical judgment plays a vital role, taking into account the severity of the infant, condition, and the likelihood of benefiting from the therapy. Additionally, the timing of the intervention, ensuring it's initiated promptly after birth, is crucial. Adherence to established protocols and guidelines helps standardize care, allowing for consistency and quality assurance. Prolonged cooling beyond the recommended 72 hours is not advised as it doesn't offer additional benefits. In conclusion, brain cooling is a valuable therapeutic tool for protecting the health and well-being of newborns facing the challenges of life outside the womb. By understanding the indications, implementation, and potential impact of this therapy, we can collectively improve outcomes for infants at risk of hypoxic-ischemic encephalopathy. As research advances, our knowledge and approaches to brain cooling continue to evolve, offering hope for better neuroprotection and brighter futures for these vulnerable newborns. Thank you for joining us today. Until next time, stay curious and keep learning.
Thank you all for watching this here.